Hello, hello. Coming to you live from my backyard. Alright, so in the Facebook group I posted a couple of articles on ice cap and the frozen gloves and socks, and I just wanted to kind of go over it. So when someone asked about it in the group, it just kind of piqued my interest, and then as I kept reading the data on it, I kind of got a little bit more excited about it. The goal is to reduce the exposure of local tissues to the drug. To protect the scalp, a cold cap on the head is designated to ease hair loss. To protect the hands and feet, frozen gloves and socks are designed to reduce the amount of drugs flowing through the vessels, limiting the injury to local peripheral nerves, thus minimizing neuropathy. And as I was reading the study data, the information on how this works is and I was noticing that this is not a common treatment that they use as a side effect minimizer. I think it should be. Now, I think it's a new therapy because when I was looking through information, I couldn't find anything past 2016, but my husband left his treatment in 2016 in September with severe neuropathy of both of his hands and his feet. And I've known several people that have done treatments and had the same side effect, loss of or neuropathy of the hands and feet. Now my kids, they have other side effects that aren't the same. I don't know if cold therapy would be something therapeutic for them or anyone along their lines. Like my oldest, he had his side effects were currently he can't gain muscle or just weight, but it could do also with he has valley fever. So but my third son, who went through chemo 2 years ago, and we just celebrated his ending of that just recently, and his is more he has to take heart medicine, and he has a chemical imbalance in his system, so you know, they all of them have chemo brain. So I'm wondering if the cap might affect that as well. So it'd be interesting to see how and where they go with this. This would be cool information. As we all know, the post effects of chemo are long lasting, and if we could minimize just a few of them, or even a lot of them, it would be great strides for the chemo patients. And like I said, I think this is a relatively new thing that they're doing, because the most recent or the latest article I could find was in 2016, and so it may not be covered by your insurance, or sorry about that. It might not be covered by insurances, but however, it never hurts to ask, is what I always say. Asking never hurts. All they can do is say no, and you figure something out. we all know that as caregivers, we want to help minimize the side effects of chemo as much as we possibly can for our patients or our loved ones. And so I'm super excited to see where they go with this. I want to see in the comments, is this something that you are using? Is it something that you've heard about? What other things are you doing for chemo side effects? What things are you helping to minimize the side effects of your chemo? What is or isn't working for you? So leave me a comment below, and I'd love to hear how you guys are progressing. We are still doing treatments. Doug just went for a look for the tumor in his right eye, and it has shrunk. So that is great news for us. We are super happy, super stoked about that. And he may have more tumors, but they are still small. So that is a good thing for us, and we are super happy about it. So that's our update, and that's my go live, guys. Leave your comments below on what you're doing and what's working, and if you've ever used the ice cap, gloves, or socks. Thanks. Bye.